Hello everyone and thanks for watching today's video. I've not done any videos on COVID-19 so far. There are lots of videos out there, tens of thousands I guess, on YouTube, etc., which are very informative. Tells you about how the virus came around and how it works, how it affects people, and how it can have devastating outcome. I myself had COVID-19 infection, so the object of the exercise today was to do a brief video about my experience of COVID-19 and some people around me who are sadly not here anymore. And also, in the next video, I'm going to talk very briefly about what I believe is the future holds for us from this infection point of view over the next 6 months to a year. Before I talk about my own infection, I will take you back to 24th of January. Now we are in United Kingdom. Today is the 12th of April. It's Easter Sunday here today. Um, However, on the 24th of January, I was in this group conference or meeting in which few of my people I work with were there, and we had few talks, etc., etc. We were talking about things, how to improve our workplace and our working experience, etc. And however, not one of us in all those talks, or even between talks in our chats, talked about anything to do with COVID 19. The only thing we complained about was how cold it was in that room. However, at that time, on the 24th of January, from now and then, it's only maybe a couple of months gone past, a bit more, maybe 10 weeks. And how things change within 10 weeks with this infection. At that time, it was a disease which we knew was happening, but it was disease far away from us. It was in China, Iran, etc. But it was not our disease. We were not worried about it. We were not concerned about it. As some of you know that I am a retired surgeon. However, I still work as an endoscopist. I do cameras of the stomach, which is called gastroscopy, and cameras of the bottom end, which is called colonoscopy and sigmoidoscopy. So that is my main profession. Now, saying that, the reason I mentioned that is because of the second date that I put on in the timeline. A colleague of mine, an endoscopist who I work with, she came from her holiday in northern Italy after a skiing holiday. And I was asking her how things were there because we knew that Italy had more infection at that stage. And you can see the timeline is not that long. It's less than 4 weeks from here to here. And I asked her how she felt over there. She said there is some talk about disease in Milan. However, northern Italy, and where she came from, there is no concern. Skiing resorts are open and people are going about doing their own things, enjoying themselves. But as you can see, on the 9th of March, which is only 18 days after I spoke to my colleague, Italy was in complete lockdown. Not just northern Italy, but the whole of Italy was rampaged by this terrible condition, which had killed thousands and thousands already. Their intensive care unit, the health system was overwhelmed, and they were in a very poor state. The second country which went into lockdown, I think, was Spain, especially in Europe, which was on the 15th of March. And at this stage, Spain, the disease was spreading like wildfire. The next date I put on is the 23rd of March. And this is when Britain went into lockdown. So if you look at the time span from the 24th of January until the 23rd of March, which is just 2 months, not even talking about the disease on the 24th of January, on the 23rd of March, the whole country is in lockdown. And how quickly this disease has spread. In my memory, I've been a doctor for 33 years. I've never come across a disease which will shut down more than half of Europe within 2 weeks. And I'm talking about Western Europe, where the health system is supposed to be very good, where technology is very good, and you would think that we will be able to fight the disease much better than other parts of the world who are less privileged. So, this is the timeline of my journey through COVID 19. My first symptom I developed was on the 19th of March, which I think was a Thursday. And I got up in the morning and I had this cough, constant cough in my throat. It was a very throaty cough and I wanted to clear it constantly. At that stage, I still got a bit of a cough, so excuse me for that. And and at that time, obviously, COVID 19 was a concern. Being a medical professional, I didn't want to give it to anyone, and I certainly did not want to go to work with an infection. And our guidelines in this country said clearly if you have a cough and temperature. So, first thing in the morning on the 19th, I did my temperature. My temperature was normal. I think it was 36.7 or 8 or something like that. And I did my temperature on 3 occasions on the day. So I did it in the morning, first thing in the morning before going to work. I did it in the afternoon at work, and I did it in the evening again, just to make sure I had no fever. I kept on working and it was fine. And it didn't bother me in any way, just this constant cough. But this time of the year, I sometimes do tend to get coughs and colds, especially runny nose. And it is my hay fever which catches up. This was quite early though. Normally I get my hay fever in end of April onwards, so this was a bit unusual. At that time I didn't think much of it, but on hindsight I think that was the start of my infection. So knowing what we know now, so my exposure to COVID-19 or to the SARS-2 virus would have been around March 5th to the March 10th. So those are the most likely dates when I was exposed to the virus. Now, how did I get exposed to the virus? Honestly, I don't know, because it must be an asymptomatic carrier. Every patient that was coming through our unit was triaged by admin staff, by nurses, then again by myself or the endoscopist who was doing the endoscopy, that they had no symptoms of cough and fever. If they had any symptoms of cough and fever in the previous 1 week, we told them not to come to the unit, and we will give them another date for the procedure. So it must be an asymptomatic carrier, or a carrier who has not yet shown their symptoms, to whom I might have gotten exposed to. Although we live just outside London, we are about, I think, 35 miles outside London, the disease has not reached us as yet. There were cases in London which were happening, and we knew about those cases in intensive care unit. We also knew that people were dying. They were dying in dozens rather than in hundreds or 1,000 every day like they are at the moment. But it was not rampaging like it is rampaging as of until today. Now, 25th of March is a date I probably will never forget in my whole life, because that is perhaps a very, very sad day for us where we worked, and for many, many people. We lost the first UK death of a doctor. Now, this doctor is the finest man I have ever known, a kind, gentle person. Even in his last days, he probably got an infection about 5 days before I did mine, because I remember him talking to one of his family members who was urging him to go into isolation because he was over the age of 70. And even at that stage, he was saying that I just need to see a few more patients, then I'll go into isolation. And I think a couple of days later, he went into isolation, which was about 10 days before this date. So around, I think around here somewhere, between here somewhere, he went into isolation. He went into the hospital. He had a cough and I think temperature. I don't know exactly his symptom because he was isolating. I spoke to him once on the phone. He was my colleague Um, he was my friend, he was my pillar, he was like an older brother and a father all in one to me. And he was a wonderful man. Um, to his family, he was amazing. Everyone he worked with, he was just absolutely amazing. He was a legend. And being a first doctor in UK to die of COVID-19, even in death, he became a legend. Um, on that day, I remember I went to the unit after hearing about him passing away, rest in peace. And I went to the unit to close the unit on that evening to cancel the patients for next day. I'll come closing to the unit in a minute, however, canceling the patients for next day. And at that time, I felt very, very tired. My cough was still there, and I lost my taste as well. But that was a very sad day, and I remember. But however, all those symptoms I put down to the sadness I just received a few hours earlier. He passed away at about 3 or half 3 in the afternoon, and this is we are talking about 5, half 5 in the evening. So within hour and a half. The next day in timeline I put down was Friday the 27th of March. Now at this stage I was getting far more tired. I was still putting down to the shock we had a couple of days ago. We were calling patients because on this day guidelines came out, our national guidelines from British Society of Gastroenterology, urging us to stop all elective endoscopies in every unit in the country. And I think most units in the country stopped on that day because the risk of transmission of infection was extremely high. As some of you know that when you do endoscopies, especially the top end going into the stomach, um, aerosol is produced. Like when you go to the dentist, obviously you have suction going on, patient is coughing, sneezing, burping, and all that produces aerosol. Although we are taking at this stage all the precautions which we possibly could with personal protection equipment, we normally wear aprons and gloves. However, at this stage, we were also wearing face visors to protect our face. However, I don't think they're sufficient. Those PPEs or protection equipment is sufficient to protect everyone and completely. Now, I remember very well on that afternoon lunchtime, I went out, I called a few patients up, and other members of staff were also calling patients up, saying because of the national guidelines, we are stopping endoscopies as of going forwards until we know that it is safe to start again. And I went just down the road from our unit. It may be maybe 50 meters away, a pharmacy, just to pick up some paracetamol. And I was queuing outside the pharmacy because they were not letting many people come in. I remember waiting outside in a queue, and everyone was keeping their social distance between each other of about a meter, 6 feet in between. I started feeling as if I was going to faint. I was just getting lightheaded and as if no blood is going to my head. I was shivering inside. It was a breezy and cold morning, but sun was out and I was dressed quite warmly. However, I was still feeling very, very cold. Didn't think of it much, thought it was a breezy, cold day. But I had to sit on the pavement I was standing because otherwise I was going to faint. And I put my head between my knees. People around me didn't think much of it, didn't say anything. Anyway, my turn came. I went into the pharmacy, ordered the paracetamol. I sat on a chair. It was warmer inside and I felt a bit better inside. Now, when I walked back from the pharmacy back to the unit, it's maybe 50 to 75 meters the distance, and it is quite flat walk. Coming into the unit is slight incline where the cars are parked before coming into the front entrance, and I went up the hill. I'm not an unfit man, I'll tell you. I take no medications. I cycle every summer. I'm not overweight either. However, I was so breathless coming up that little incline, and I had to stop outside because my chest was hurting. I could not catch my breath, and at that time, that was the first moment I realized there is something not right here. This is not normal. And then I came into the unit, walked into the unit, and I had to climb up the stairs to get to my office, which is about maybe 13 steps up. And on those 13 steps, every 4 steps, I had to stop because I cannot get my breath. I could not get my breath. Then I went another 4 steps, then I stopped. Eventually, I got up. And before speaking to anyone, I had to catch my breath because I just could not speak. Next timeline I've put down is from 27 to the 31st of March. This was a Friday, and I think this was a Tuesday. The reason I put these dates down is I have very little memory of what happened in this time. I have been ill like most of us in my lifetime. However, I cannot remember being as ill as I was then. Um, my main concern at that time was not what will happen to me, because I already had seen someone's death few days ago, and I knew that probably it will likely to happen to me as well. I don't think that scared me that much. However, what scared me most is my people I'm going to leave behind. Many of them are financially and emotionally dependent on me, and I had not taken care of them completely. That was my main concern. I went to bed on Friday evening that day unusually early, about 7, half 7. I was very cold, so I wrapped up warm, and my chest pain was very bad, and and I was very short of breath. I was not short of breath lying down, but I still wanted to breathe deeply to catch more oxygen in my lungs, if it makes any sense. Um, on in the 28th, I think I slept all day. I can't remember much of it. 29th, which was a Sunday, I tried getting up to make myself in the morning. I was very hungry to make myself a cup of tea and get some breakfast. However, kitchen is not that far from my bedroom, and I just had to lie down on the floor, yeah, because I was so short of breath and my chest was hurting. That was the first day. Um, I did not think I would survive that day, and came very close to calling the ambulance to go to the hospital. Um, However, I didn't have to, and I was lucky, I think. The 1st to the 2nd of April, um, I started feeling better, and I was not tired anymore. I was still a bit short of breath, and obviously cough was still there. 5th of April onwards, which is until today's date, which is the 12th today, my breathlessness is almost completely gone. I don't feel tired. I'm doing my normal activity. I still have a cough, which keeps irritating me. However, not so troublesome at the moment. Now, uh, what I think made me survive, you can call it whatever you want. You can call it luck, you can call it God's will, you can call it chance. Maybe it was all of that. There was nothing, honestly, there was nothing I could do to change the outcome of this disease. This disease you can't hear, you can't taste, you can't smell, you can't see. It's a silent killer. When it comes, if you're lucky, you'll pull through it, or if it's God's will, if whatever you want to call it. If you're not lucky, you cannot pull through it. There is no treatment for this condition. All I took was paracetamol. That's all I could take. There was no treatment for it. The other option was, if I have gotten even 5% worse, I had to go to the hospital for to go on breathing support of one or the other. I did not want to do that because I don't like hospitals very much, and also there were far needier patients who needed hospital care. Um, Sorry, this video had become a bit longer than I wanted it to. I just wanted to do one very short video next time. I hope it stays short anyway. And that was about which people get better, which people get worse. So I urge you, please keep your social distance. It might not sound logical, but it is. It does help. It does not help you. It helps other in the society as well. Don't take this infection lightly. I have seen many epidemics, many illnesses, many killers in my life. I've never seen anything that which cannot be treated. It's got no treatment whatsoever. It's got no prevention whatsoever. There is no vaccine that can protect us against it. So please be safe. And I'll upload two videos together. And the second video, I'll briefly talk about how I think which people get better at what stage and which people get worse. In the last video, I talk about what I think will be the future of this disease over the next 18 months. Thank you for watching.